So when you're working on this, for 5 minutes you may feel some vibration, but when you're constantly working on it, reducing a little bit that vibration has a dramatic effect on the long-term health of the user. It's extremely important. It's actually one of our key initiatives now, because we understand that health and safety persons or officers need the engineering technology to have controls on site, to remove the human factor from it. So we develop new technology, new tools, new ways to make the work safer and more productive, of course. But when you increase safety, you increase everything in the job site.
Chemical glove, we have insulated gloves, we have cut-resistant gloves, disposable, general purpose. We've noticed a big increase in the demand for cut level. Before it was not really considered, but if you think a glove that can, even a small cut can really cut down on your claims, your workers' compensation rates. So we're really finding, probably in the last year or two, a real push for more and more hand safety.
Also a big awareness creator for us too, right? Our ultimate goal is every family in Canada who's experiencing workplace tragedy becomes aware of Threads of Life. Yeah, so if today is a typical day in Canada, 3 families are going to get notified that their loved one isn't coming home. And that has a devastating effect on the family, on co-workers, and on the entire community where these tragedies happen. And Threads of Life is there to help families heal and recover from these workplace tragedies.
At WorkSafe New Brunswick, our ultimate goal is to prevent an injury, a workplace injury, before it happens. And so this conference is key to providing some of the education and for developing that safety culture in New Brunswick, because the best injury is the one that doesn't happen and doesn't come through our doors.
Diphoterine is a chemical decontamination solution that you would use for a corrosive chemical splash to your skin tissue or eye tissue, as opposed to going in water. It's important for our brand, the Provor brand and Levitt Safety, because what we're trying to do is help companies have a better understanding of managing chemical risks in the workplace and what is available to them now, what's been available to other organizations in other countries now for quite a few years, and helping to bring this product to market in our countries.
So in New Brunswick, just like across the rest of the country, we've seen leaps and bounds as far as health and safety is concerned in workplaces. Today, personal protective equipment is mandatory, and most companies certainly follow those compliance requirements. But we still must continue to educate people on health and safety behaviors, because it's a cultural piece that needs to be supported throughout the workplace in order to make that behavior change. So it's not just about putting on your personal protective equipment, but it's about understanding why we do that, so that we can all make good decisions, so that we get home safe to our friends and family at the end of the day.
There's too many tragedies where families are torn apart or workers suffer terrible injuries, and we're here to prevent that. That's why we're here.
This is, I think, our best turnout in quite a few years. We've got almost 600 delegates registered, and this is a great opportunity to get a group of people who, just by their attendance here, signal to us that they are safety leaders in their workplaces, in their industries, and it's an opportunity for us to get them together and talk about a variety of different issues. A lot of discussion about some emerging issues like cannabis in the workplace.
It will be legalized so people can use it, but there will be certain positions that are extreme safety sensitive positions that employers will have different rules for. And so that's one of the learnings or the exercise they're going to have to go through is what is permitted off-site as it may impact your work site. And again, it's an area where we're going to do a lot of learnings, but across the country we've already seen some workplaces where use is prohibited because the position is such a safety-sensitive one. If the workplaces, the employers, focus on having a solid policy that's well-written and well understood by the employees, then cannabis fits into that.
Most of us in this room think we're pretty good drivers. I'm here to tell you you're not as good a driver as you think you are.
Well, effectively, I would like the participants, the people attending the conference, to have better awareness of the risks associated to driving, and to start a process of self-assessment relative to how they drive. I'm certainly not here to teach them how to drive, and I'm certainly not here to tell them how to drive. I simply want to plant some seeds and get them thinking about something they do every day and something that is incredibly risky.
And the problem with driving is how quick things can happen in milliseconds.
One of the most interesting statistics I've seen is that motor vehicle crashes are the #1 killer from age 4 to age 34. And the only reason it falls out of #1 after age 34 is heart disease and cancer supersede it. So it's also the #1 cause of death in the workplace. Individuals who are driving to and from work and who drive vehicles as part or all of their occupation are at high risk. With all the gadgets we have nowadays in our vehicles, distracted driving is a huge problem. In fact, most provinces now have reported that distracted driving is killing more people on our highways than alcohol is. My key message is how complex driving actually is. And the problem, and it has to do with the brain, the problem is most people find driving very easy. But in reality, it's an incredibly complex task where things are happening in milliseconds. So my key message is that good drivers just drive and stay away from distractions and focus on the drive while in fact they're performing that task. Most provinces and states have adopted what is referred to as hands-free legislation in relationship to the use of cell phones and having those conversations. The problem is the issue isn't with the hands in the first place. It's not the actual use of the item. It's the fact that the conversation is actually taking the individual away from the task of driving. And a lot of people will say, well, that happens all the time with passengers. And it's true, but the difference is your passengers in your vehicle see what you see as a driver, and they know when not to talk and when to avoid conversation and to give you some assistance while you drive, whereas a person on the end of the phone does not.
People really struggle with finding good hazard assessment processes for their work environments, right? It seems relatively simple when we think about it, but there's so many processes and there's so many names of processes and types of hazard assessments out there. Sometimes it's a really daunting task, right? And we have to do a really good job at it because that's the kingpin of having a good safety program, isn't it? We need to know what the heck hazards we're dealing with, so we can design systems and identify them, and so we can design processes or control strategies to ensure that we're, if we can, the very best thing, to eliminate them, but if we can't eliminate them, right, to put effective controls in place so we can lower the risk of those hazards to the people that we work with as low as possible. A good hazard assessment system is a continuous process. We can't escape hazards. They are everywhere, right? When you drove here, if you came today, when you drove to the conference, you faced hazards. The good news is that we already have an internal process that helps us identify and control hazards. So I'll give you an example. Fast forward to January. How many of you have to drive to work, right? Some of you, maybe are fortunate enough to live in the city. Okay, right. But sometimes it catches you off guard in the wintertime, doesn't it, right? So have you ever kind of checked out the forecast? You know you have to go somewhere the next day, right? You got to go somewhere. We throw open the shutters and we look outside and we see it snowing. That's a part of hazard identification and control that we do unconsciously. But a lot of you said you still had to drive. So what kinds of things might you do differently? Slow down, leave early.
Wait till the snowplows are done.
Wait till the snowplows are done. Leave a little bit more stopping distance between you and the car in front of you. Right?
Work from home.
Work from home. Yeah, absolutely. You know what they're called? Hazard control, right? Now, all of those things do not eliminate the hazard. We consider that, and we put all these things in place and say, okay, I've got to go to work. I still have an elevated risk in my head, right? Perceived risk in my head of this activity, so I'm going to do all of these things. Now I think it's a little bit safer. That's what we call risk tolerance, right? So we know the risk is there, but we've effectively put what we call these fancy things called controls in place, or corrective actions, to mitigate or lower the risk to ourselves as low as possible. There's other things that we do. Those things that we just talked about, slowing down and so on, in our programs, we often call those safe work practices. There's other things that we do, in some cases, even preparing for a perceived hazard. So we know winter's coming here, right? Everybody knows we're not going to get away from it, right? And we're all pretty sure that with winter comes some crappy driving, yes? Okay. So what do we do in preparation of that? That's a perceived hazard. Winter tires. You guys, anybody here put winter tires on? Please put up your hand. Yeah, okay, absolutely. Anybody here have a four-wheel drive, right? Or an all-wheel drive, right? How important is having a good windshield or a full windshield washer and so on if you're traveling on the highway, right? It's pretty important, right? So we change our habits somewhat as well, right? That's the whole hazard identification process. You do it all the time. We do it. We don't even realize we're doing it. Subconscious, right? What's a hazard? Anything that can hurt you is a hazard, right? Or interrupt your work process itself. Where do hazards exist? Whether they're performing unsafe acts, their training, their experience, and so on, right? The equipment or tools that they use, the materials that they use in their work environment, the work environment itself, right? And the process. 5 different categories of hazards at our workplace that we deal with at NBCSA, right? The first one is physical hazards. Anybody want to take a guess at something that falls under a physical hazard? Slip, trips, and falls? Yeah. So a physical hazard in a nutshell is when our body comes in contact with an energy force that is too great for us to absorb without injury, okay? So think of the impact at the end of a fall. Think of coming in contact with electricity, right? There's a couple others. Anybody want to take another guess at what a couple more might be? Moving equipment, right? So getting struck by, right? Car crash, yeah. Anything else? Wrong tools for the job, yeah. What about vibration? What about temperature, right? And radiation. There's some of the big ones that fall into that. We're not necessarily talking ionizing radiation like you guys would deal with in healthcare, right? So ionizing radiation is the worst of the worst, right? It's the stuff that you could be exposed to at a hospital if you're getting x-rays and so on, right? Non-ionizing ones, most of us are exposed to it at some time or another if we ever go outside, right? We're exposed to sunlight and radio waves, microwaves, and so on. Vibration hazards can be caused by using handheld tools, right? Camping machines, jackhammers. What about another industry? Anybody think of one in your industry that might? Anybody here in landscaping? So some of the landscaping tools that are used cause it as well. Temperature extremes, that could be indoors or outdoors.
The new regulations on violence and harassment have certainly brought a lot of new conversation into our day-to-day work. So our new regulations, we're going to talk a bit about those today, but it became really apparent to us as we were looking at our new regulations and being aware of some other new regulations that are currently happening in the province around domestic and intimate partner violence leave, as well as some of the requirements under the Human Rights Act with respect to harassment, that there's an intersection and there are some links that are happening between the 3 agencies. So between Employment Standards Branch, Human Rights, and WorkSafe New Brunswick, we have work to do in support of all of those issues within the province.
I think one of the things we notice is that once society becomes aware of it, it's something that we have to address, and workplaces have an obligation to keep their employees safe from harm, and that workplace harassment is part of that. Traditionally, we've been an organization focused on what I'll call the engineering side of safety. Are guards in place? Have we locked out our equipment? And now we have to start looking at inside people and how people behave and react to each other. So it's a different skill set. Employers have to understand what they have to do in the workplace, and that's all about the learning. We're going to take this one step at a time.
Critically important, and we're seeing a lot of employers working on not just health and safety in the workplace, but wellness and mental wellness. And you're right, it's not just about the workplace. Just like safety, it's not just about the workplace. It's safety at work, at home, and at play.
So there was 92,000 people that were victim of intimate partner violence. 4 out of 5 of those victims, so 79%, were women. Out of that, 2,122 people in New Brunswick. So we're the highest in the Atlantic province for numbers of domestic violence that were reported. Again, as we know, most aren't reported. The timeline, how this piece of legislation came about. February 2nd, 2018, the government introduced Bill 44. Part of Bill 44 was the domestic intimate partner and sexual violence leave. There was also the leaves, maternity and child care leave changes occurred in Bill 44, and critical illness leave for adults was added at the same time. On March 16th of 2018, Bill 44 received royal assent, and it became law September 1st. So there was a consultation, a 60-day consultation held for the drafting of this piece of legislation, and there was 120 stakeholders that participated. There was a varied group that participated in the talks about what this legislation would involve and would include.
The other thing to keep in mind is that there are people who, just because of certain characteristics that they have, are more vulnerable or at higher risk of becoming victims of sexual harassment, and the stats will support that. Some of those might include race or ancestry, newcomers, sexual orientation, either the disabilities, family status, marital status, etc. They can become more vulnerable to sexual harassment. In one particular case here, this one here from Ontario, 2 temporary foreign workers came to work. This is in Ontario, came to work at a fish plant. They were, their passports were taken away from them. They were forced to perform sexual favors in order to not be returned to Mexico. They filed a complaint. The one sister was actually sexually assaulted criminally. She received $150,000 in general damages, and the other sister received $50,000. So when you look at employers' duties, you have access to all these slides. The biggest thing is that, do you have a policy in place? If I come in and do an investigation, I want to know, do you have one? When did you implement it? When was it revised? Where do you keep it? How is it accessible to your staff? When did this last time that you did the training? And what update? And are you applying it consistently? As employers, there is a duty to investigate complaints and address allegations immediately. Don't have to be perfect, but you do have an obligation to address them right away. Employee does have duties as well. Follow sexual harassment policies, report incidents immediately, and work with the employer to address the sexual harassment problem. And lastly, this is what we're going to be looking for. This might be helpful to you if you're doing any of these types of investigations in-house. In terms of proving or establishing sexual harassment, alleged conduct or comments, so the behavior was unwelcome, or was sexual in nature, it has to be sexual in nature or it's not sexual harassment. They were unwelcome to the complainant and they had some kind of negative impact on the complainant's work opportunities or environment.
This for yourselves and for us as well, this is a new regulation. So the ink is barely dried, coming into force on September 1. We're still gearing up, have working groups and subgroups working on how we're going to roll it out. What resources do we think you might need in order to implement? And also we're getting a lot of questions now, and we suspect that we'll be getting a lot of questions today, which we hope, because they will help us prepare as well. We'll give you the answers if we have them. As you probably know, certainly workplace violence has been an issue for quite some time. And while WorkSafe right now until April 1 next year, while we don't have a regulation in place, we have been dealing with the matter of violence through our general duty provisions. So while there were no specific regulations, we were still able to to address it. Now, workplace harassment, on the other hand, is another issue. We have received from time to time in the last several years some complaints, and because we really didn't have the legislative mandate to address those, for the most part, we were referring them back to the New Brunswick Human Rights Commission, and that's pretty where they were handled. But the other reason, too, of course, is you may not know, but in terms of violence and harassment, New Brunswick is one of the last jurisdictions to have such legislation. We're not last yet. The jurisdiction in Yukon have neither. So really, because of the issues that are emerging, and they're really important issues, the government of New Brunswick felt it was important that we move in that direction as well. And that's exactly what we've done. So what you'll be seeing, an overview today, is the product of the discussions we've been having in the last 9 months or so. Now, thirdly, of course, workplace violence, workplace harassment is very costly to workplaces, both in terms of health, in terms of workers' compensation. So it's certainly timely. What are some of the highlights, and what do employers need to do? Now, the main difference between workplace harassment and workplace violence, what you'll see is that there is no need to conduct risk assessment for the determination of whether you might have workplace harassment in your workplace. The premise, when we were discussing the development of the regulation, was that we felt that the risk was significantly high, pretty well in all workplaces, that this could occur, and therefore we went this route. So basically, we've eliminated a step. I'm telling you that when the regulation comes into force, you'll need to develop a code. Now, with respect to violence, however, it is a two-step process. There will be a requirement for all workplaces in the province to develop to conduct a risk assessment, and then with the risk assessment, then you will take the results of that and proceed to conduct develop and implement a code of practice. There will be some exceptions for the development of a code of practice, and I'll touch on that a little bit later on. So what you'll find, there's kind of a three-tier component or two-tier components within the new regulation. If you are 20 or more, if you are an employer with 20 or more employees across the province, it doesn't matter if you have one place of employment or 10. If you have 20 or more, you're going to have to develop a code of practice. No exceptions. So you will conduct your risk assessment. There will be an outcome of that risk assessment, and you're going to have to do a code of practice. Now, if you are 19 or less, if you have 19 or less employees across the province, and your risk assessment shows that there is a risk of some violence at your workplace, then you're going to have to also develop and implement a code of practice on violence. The third one is there is a specific industry and a service provider list within the regulation that's defined. I'll touch a little bit on it later, but basically, so if you have 19 or less and you're in a particular type of industry that's listed in the regulation, and there are several, or you have an occupation or an activity that's also defined in the regulation, then you will also have to do a code of practice for violence. And here's the exception. There was a lot of discussion on that. If you are an employer with fewer employees regularly employed with a risk assessment that shows minimal or no risk of violence in the workplace, you will not have to develop and implement a code of practice. We'll start with workplace harassment. Here's the definition. I'm not sure how many of you have had a chance to see the regulations, but I think it's important because a lot of the things that will trigger any events will definitely depend on the regulation, on the definition, and thoroughly understanding the definition. We define harassment in a place of employment means any objectionable or offensive behavior that is known or ought reasonably to be known to be unwelcome, including bullying, or any other conduct, comment, or display made on either a one-time or repeated basis that threatens the health and safety of an employee and includes sexual harassment but does not include reasonable conduct of an employer in respect to the management and direction of employees at the place of employment. We did do a jurisdictional scan across Canada to determine what other jurisdictions were doing because we felt that since others had experiences, and how did they find the various behaviors, If we could line things up, we could certainly learn from them, and that's when we went there. The matter of does not include an employer's ability to manage his or her workplace. We certainly, when there are complaints that come in for harassment, there are times perhaps it's just more of a management employee issue on a matter of discipline, a change in work schedules, and a manager trying to get an employee to improve the quality of his or her work. A lot of these things can be seen by an individual as being harassment, but our efforts will be to make sure that we try and triage those, and we hope with this kind of definition that will happen more at the workplace rather than us having to moderate and triage. Many medium, large employers are probably already there. So some of you probably already have policies, procedures. We call it a code of practice, and you're probably already managing it okay. So probably what the regulation is going to do for you is you may just have to review and maybe tweak them to make sure that they line up. We anticipate that smaller employers may have more difficulties, which is why we're putting a lot of emphasis on guidance documents, communications material, and like I said, by the time April 1 rolls around, hopefully we will have all of the materials that you're going to need. So what are some of the components? Well, the first thing you'll find in the regulation is we want your code of practice to have a statement that employees are entitled to a harassment-free environment. And so those will be important components to have. We do want you to, the code to identify who will be responsible for the implementation. Certainly if there's going to be any health and safety officer visits, and there will be from time to time, I'm sure, we will be looking for who is the author, who is responsible, and is it being managed, and is it being followed? So we will certainly have these discussions when we get to the workplace. Now the framework that you see here, if you've worked with other requirements for code of practice within our regulation, you might find some similarities, and that was intended. We want to make sure that at least that the models that we have now for other aspects of our legislation would be followed here, and there are some similarities where there could be. There will be a need for corrective procedures for corrective measures, how the complaints would be followed up at the workplace, and also the code will have to identify what training your employees are going to need. Now for workplace violence, we also have a definition, and again, when we did our jurisdictional scan of other jurisdiction, we tried to borrow what was working well, and this is the definition that we came up with. Violence is defined in a place of employment means the attempted or actual use of physical force against an employee or any threatening statement or behavior that gives an employee reasonable cause to believe that physical force will be used against the employee and includes sexual violence, intimate partner violence, and domestic violence. Now the last part of the definition you'll probably recognize from the presentation from Employment Standards Group, and that was an intent when we were developing the regulation that we try and line up as much as possible with the other statutes in the province, and that was one aspect of the work that we were doing. I'd like to talk about what will be required in your risk assessment. As I mentioned earlier, the violence issue is two parts. First part, risk assessment. Second part, code. So just briefly, what will be needed in a risk assessment? You will need to identify where and when the work is being done. So is there a particular part of your workplace that might be have a higher risk of violence, and or will there be a particular time of day? So when you look, for example, things like convenience stores, if you're open from 9 to 9, maybe not so much. If you're open all night, convenience stores may have more risks for violence in that regard. You will also have to consider, are there matters of sexual violence, intimate partner violence, or domestic violence that may creep into your workplace? So if you are aware of that some things may be happening in one person's home of that nature, is there a possibility of it being spilt over into the workplace? And that's what that provision is intended there.
If you have an employee who accesses the domestic and intimate partner violence leave under employment standards, are you as an employer then seized of the knowledge that there is possibly violence occurring at home to one of your employees, and what are your obligations at that point. The duty to inquire certainly would have some context there, and as an employer you certainly need to ask the question if it's possible that that violence could spill over into the workforce, into the workplace, I should say. So there's some subtleties in this regulation that we're still bringing to the surface and learning about, and certainly working with our counterparts at Employment Standards and Human Rights. Those questions and answers are going to be coming forward in the next few months.
How many of you in this room have suffered from, struggled with at any time in your life or now, a mental health struggle that was enough that made you say, well, this is really affecting my life? Raise your hand. Thank you for being honest. The negative impact of unspoken mental illness is devastating. And like the stakes of getting people to share, especially in the workplace, they couldn't be higher, because people die. People die very often in this country of Canada, where it's 2018 and where we have all these great initiatives to talk about it. Still, 4,000 Canadians will take their lives, and many of them will take their lives because they never got the help they needed, and they never got the help they needed because they were too ashamed, too afraid to share. And in particular, in the workplace, if you don't feel like, even as a healthy person, mentally healthy, if you don't think, well, hey, one day if I'm sick, I can go to my boss and talk about it. If you don't feel that way, then you got a problem. You know what? 4,000 Canadians every year take their lives that we know of. There's probably another 4,000 that we don't know of. And you know, there's 25 suicide attempts for every one that's completed. That's minimum 100,000 people. You know what? There's probably 10 people for every one that attempts suicide that thinks about it but never did. So we're not talking about something that's incredibly rare. It's weird how there's such a dispute over how big a problem is this. Because I think there's a lot of wishful thinking going on, especially from those that are involved in trying to reduce the stigma, which, you know, in a tiny way, that's me, right? That's what Sick Not Weak does. That's our goal, is to change people's view of mental illness, to show them that it's a sickness, not a weakness. So in theory, I should be one of those people that go, oh man, it's getting a lot better. But I don't think it is. I think still at our core, we see something like depression as being self-inflicted in some way, as some way being reflection of personal weakness. And until we break that, it'll continue to be a huge problem. People will continue to have to live in the closet, continue to deny themselves help, and continue to be bad caregivers for those that are suffering. Because if you don't understand it, how can you help? You know, I'm just a guy who's spent his life working at a job that maybe you saw me working at this job. But I am you. I am prone to the same problems as you. And you know what? I have been taken down by this illness. So when I was looking up and speaking to my depression, that is the start of my story. If Doug came up here and said, you know what, you were disrespectful to me in that opening when you made that joke and he punched me in the side of the head, I would know that Doug punched me. Although I'm not really afraid of Doug. I don't think his punch would be that good. But I would know, right? I wouldn't be like, oh my gosh, Doug's head hit my head. What happened there? I would know I got punched. But depression is the opposite of that. Depression is a tiny, tiny tap that changes you in a tiny, tiny way. So small that you would never notice it happening on a given time, right? So you don't know that you're changing. That's the insidiousness of depression. Well, one of the things about mental illness is you can't tell who's got it, right? I mean, if as a sufferer, as someone who has gone through times when I have relapsed, where I've fallen into the deepest, darkest hole, I can tell you that if I don't want you to know I'm sick, you're not going to know I'm sick. So the magnitude of the problem in a workplace where people work together for 8-10 hours a day, we have no idea how big it is. Because especially 8-10 hours a day, anybody with depression can act. We can fool you. We don't show you. Listen, this is really important. I don't show you what I feel. I show you what I think you want to see in me. And that's true of people that work in television all the time, right? And that is the single biggest problem that mental illness does to us. It takes away who we are and replaces us with someone else. Because all my flaws, now on a day when I can be me, it's like, oh man, I just love this. I can accept everything that I can't do because I am me. And when you are sick and when you have been stolen by this illness, I can tell you the only thing that you want back is you. So when you realize that, you need, the hell am I doing with my hands? Let's all bow our heads and pray. Any Jewish people in the room? None? Not one? Anyone ever meet a Jewish person? Besides me? Now I will fast forward through, I guess, about a decade where I suffered, I went on medication, I went off medication, I relapsed. So it was a big factor in my life. But here's the thing that people don't talk about. So this is depression, the unwritten story. What happens? It takes away our self-esteem. It stops us from believing in ourselves. Most of my struggles were internal because I did share my struggles with people at work. So they knew about it. But I was devoted to the idea that I would perform as well as I could if I wasn't sick. So I was so intensely, absolutely obsessed with the idea that I'm going to do a show and no one's going to know that I'm sick. I go to work, I got a show to host, I got 4 amazing guests. I'm not going to enjoy that. I'm not going to experience joy from that because I can't do it. And that's why mental illness is the hardest thing on the planet to be a caregiver for, because you think you understand it because you've all used the word depression, right? Like we've all used it, whether we've had the illness or not. But I'm here to tell you that you don't understand it, nor should you, right? Like I don't understand what it's like to live with terminal cancer, nor should I. Although I'm a bit of a hypochondriac, so now that I said it, I'm kind of afraid. Do I have terminal cancer? Oh my God, am I sick? Does it seem like something's wrong with me? You know, it's hugely important because all of the people that you mentioned, whether it's family, whether it's employers, whether it's coworkers, they all have some specific relationship with the person that's suffering, and they all need to support in different ways. Support is not one thing across the board, right? It's not like doing CPR, where you do CPR, whether you're a brother or sister or a parent, you do it the same way. To be a caregiver to somebody who is your employee or your coworker or your family or your friend, it's all really different, but it all comes back to the same thing. You need to break yourself of the stigma. If you believe that the person that you care about and that you want to do well for is somehow suffering from a self-inflicted illness, you will never be the caregiver that they need and that you want to be. So it's about understanding, it's about education, and it's about finally breaking away from the idea that, hey, it's the, come on, Michael, you got a great job. Come on, I know you're depressed, but that's how we've thought for hundreds of years. And until we break it, none of us will be able to give the best possible help. Fight for your happiness. The first thing I ever said when I came out and talked about this and someone asked me for help was, all I know is you got to fight. And this is an incredibly difficult fight because by its nature, mental illness robs us of our confidence, robs us of our self-esteem, robs us of our get up and go, our drive, our passion. It robs us of our energy. I came from a house that was incredibly loving. Right? My parents thought I was the greatest. My brother and I were like the greatest thing on the planet. And they would have done anything. And they did do anything for us. And if I would have said, you know, I'm really, I don't know why, but I'm so scared of all of these things, they would have understood and they would have got me help. But I never did. And I think because at that point, I was for sure embarrassed. But beyond that, I don't think I understood that I have an illness. But on those days, I don't believe that I am significant. So I start to beat myself up. Oh my gosh, why did I do that? And I will always, my daughter is always the person that I message, the one that called me, and I'll say, I'm going to suck. This like actually happens. And she goes, you may think that, but other people won't notice that. And I go, well, it doesn't matter to me that other people may not notice. It matters to me that I will notice. That is depression, the loss of self-esteem. So the guy that you may have accused of being super arrogant and super cocky, he experiences it too. You don't know when people experience it, the loss of self-esteem, because they're acting, they're hiding it. But I can tell you that that aspect of depression is the most devastating, because without self-esteem, everything is 1,000 times harder. That's why I came from the center of the universe to be here. But when you're in the center of the universe, every place is accessible. So I'm here because of those emails. But now let me go to Tyson Williams. Like again, you're going to think, he's just making that up. So one of the emails is from a guy named Tyson Williams. I corresponded with all of these 22 people because as I was apt to get emails back then, like we would get lots of emails to the show, and typically they said nice things like, hey, Landsberg, you suck, you douchebag. Literally. And I never felt really an obligation to respond to those. Although I found them kind of funny, but these were different, right? So I corresponded with all of them. 2.5 years later, I get an email from Tyson Williams in North Battleford, Saskatchewan, the same one that texted me, the same one that just sent me a picture. And it said this, hey, Michael, 2.5 years ago, you may not remember this, and I did. He said, you and I corresponded 5 times. I never told you what was actually going on in my life. I told you that I was really sick and really shy and really afraid to get help. And you said to me, well, you know, why not go for help? And I said to you, I could never do it. And I told you it was really good that you and Stéphane Richer did that, but it wasn't going to work for me. And then finally, you said something that kind of clicked with me. He said, but what I didn't tell you is that when you corresponded with me the first time, I had a belt around my neck and I was in my closet. I had written a note to my daughter and to my parents, and I was going to end my life because I thought to myself, I am a loser. I have whatever it is I have will never get better. I'm in too much pain. And you know what? This is the voice of depression. This is how it can fool us. Imagine a parent thinking, my kids would be better off if I took my life than I'm alive. That's how convincing it is. It can talk to us in a way and convincing us of things that we could never imagine. So he said, I didn't tell you that I was in the closet with a belt around my neck. And then you corresponded again. I took the belt off because I thought maybe it's going to be somebody in my family again. And I went and I saw it was you, and I messaged you and I said, hey, you know what, good for you guys for talking about it. Then I went back to the closet and I put the belt back around my neck. He said I was committed to the idea of ending my pain. And then the computer went again and again. He said, the last thing you said to me, even though I didn't know any of this was going on, so this isn't me going, oh my God, I got to save this guy's life. I was trying to convince him to go for help. And I said to him, what do you got to lose? You know, you say you have severe depression, you know, your life's a misery. I go, really? Like, I know you're embarrassed of your illness, but could it be that much worse? I mean, like you go to the doctor, you're in the doctor's waiting room. First of all, the receptionist isn't going to go, hey, Mr. Williams with depression, you loser, it's your turn. No one's going to know, but even if they did know, how much worse could your life be? And he said, you know, that resonated with me. So I went for help. 2.5 years later, here I am, and I can tell you that for 2 years, I have lived in a way that I never lived before that, because I couldn't ever remember not being sick. And it's only because 2 people shared on television and because someone took the time to answer an email. I'm alive because of that. That's the email that I got from Tyson Williams of North Battleford, Saskatchewan. But 2 years later, after that, I get another email that says, hey, Michael, take a look at the attachment here. It's an attachment with a caption. The attachment says, is a picture of Tyson Williams in a Boston Bruins jersey and a newborn baby in a Boston Bruins sleeper. And he said, meet my newborn baby daughter. This is what happens when 2 guys share. And that is like such an incredible story that it's not over yet. This, like honestly, you couldn't script this stuff. So, I mean, there's a really funny part of the story, which I don't have time to tell you. But now, get ready for this, because you're all going to do this. I know it, right? Especially the women are all going to go, aw, you can't help it, right? You're going to try. You're going to say, he thinks he owns us, but we're not going to make the aw noise, but you're going to make it. You ready? So I get an email 2 years ago from Tyson that says, hey, Michael, will you be the best man at my wedding? So I hauled ass out to, if this is the greatest, anyone from Saskatchewan here? No? One person from Saskatchewan. So I'll lay off the Saskatchewan jokes. I was going to say, you know, like the East Coast may be like one of the greatest places in the world, right? No one has ever said that about Saskatchewan. So I hauled ass to Saskatoon and then drove north to Prince Albert. But God forbid he has his wedding in his hometown of North Battleford, which is an hour from the airport. No, he's got to go to Spruce Home, Saskatchewan, which is another hour north of Prince Albert, Saskatchewan. It happened because I have this really devastating illness. And it happened because I found out by chance that talking about my really devastating illness could make a difference in people's lives. On a good day like today, in front of you folks, feeling good, I say one of the best things that's ever happened to me is getting sick. And one of the coolest things in my life is this poison that I have inside me called depression, I get to use as somebody else's medication. I get to use it to help you. And I'm telling you, the reason why I'm on this stage is because I get you, I understand this, I am you. So I can say this, I believe in you. If you're struggling, I believe in you. And you might say, well, how can he believe in me? He doesn't even know us. I believe in you because we share the same feelings. It's no tougher, no less tough for me. I believe in you because I am you, and I believe in me. I'm here on this stage to tell you that. I'm here on this stage to tell you if you care about someone with a mental health challenge, you need to research, and you need to go to them and say, I can't understand what you're feeling. You may think your whole life, I understand depression. You may be thinking that. And I probably thought that too. So this isn't me up here preaching and saying, you guys are evil and I'm good. I always understood this. I had no freaking clue. I never thought I didn't understand until it hit me. And then it was, on that day when I realized that I was sick, it was like, oh my God, this is nothing that I imagined it to be. This is like, oh my gosh, it's like I'm possessed by something that I couldn't possibly understand. But now, feeling it, understanding it, oh, I get it. And boy, was I ever wrong. And that's, like I said, that's the way it should be. You wouldn't say to somebody who's having chemotherapy and has a 10% chance at being cured, you wouldn't ever say, hey, I can understand what that's like. The whole idea of your well-being, your life being threatened, we can't understand. And that gets me to another bizarre thing about lack of understanding. Lack of understanding when it comes to suicide. Because we can't understand why people take their lives. Because we have inside us, we are mostly born, most of us, with this drive to survive, right? So if you go to the doctor and you think there's something wrong with you and you go, I got this, this thing in my neck. And believe me, I've done that many times. I've had a lot of things in my neck, which actually weren't things in my neck. If no one's ever talked about mental health in the workplace, if the employer has never said, hey, you know what, I know, I have 10 people working for me. I know 2 of you over the course of the next 5 or 6 years or 10 years are going to get sick. Or if I have 1,000 people working for me, I know that it's going to be a lot more than that. The employer needs to say, I know that you're out there and I know that you will get sick. And if you don't believe that you can knock on my door and say to me, hey, Michael, I need to talk to you because I'm struggling and I need help with this. If you haven't opened up that possibility, and most of all, if you haven't assured me that if I walk into your supposedly open door, close the door behind me, tell you about my depression or mental health struggles, if I don't believe that this is not going to hurt me and my chances of promotion, my chances of keeping my job, then I will never tell you. So the groundwork has to be laid before the time of crisis. So when that person is struggling, when that person needs help, they feel like they can knock on your door. Sometimes it's hard, to talk about this stuff. Not hard for me to say it because, as you can see, the message I've conveyed is that, I'm good with this, right? I'm not ashamed. But, I flash back to moments in my life, moments like going to family function. My wife comes from a very big family, so big family function, where I'm sitting at a table let's say, one of these. And I go, hey guys, I got to go to the washroom. And I go to the washroom and I just stand in the washroom. I just stand there because I had to get away from everyone. I mean, this isn't like the distant past for me. This is recently as a couple of months ago. Because I just don't feel good. And being around people, talking to people is so painful. So I stand in the washroom, right? Now, it's a bit risky to stand in the washroom because it can be creepy, right? Guys come in the washroom and they go, oh my God, I came in here like 2 hours ago and he's still here? Yeah, then they call the cops and, you got to explain why you're standing in the washroom. But that is my escape. And when I think about that, I go, wow, that's been a large part of my life. And that sucks. But you know what doesn't suck? My chance to be up here and share this with you. My chance to come to this, no jokes here, this great place in Canada that I probably would never have gotten the chance. I get to get picked up at the airport by someone that immediately becomes a friend. I get to talk to people at a level that people don't get to talk about. I mean, this is real personal. And I get to use that bad stuff for good stuff. And I get to say to you, if you're in this room right now and you have struggled with what you think might be an illness, ask yourself, am I okay? Like, really ask yourself, am I the same person I was? Am I the person that I want to be? If you're in this room and you know you're struggling, but you don't feel like you can share, you can share. It's a skill that you develop. You know what? First time sharing for most people is like next to impossible. But after you do it once, it's a little bit easier. And then before you know it, you're on stage and it's blah, 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 almost boasting about your depression. It can get to this point. So share once. Pick one person. And if you don't have that one person to share with me. I have a website. I have a Twitter page. I'll direct message you. You can email me, michael.landsberg@sicknotweak.com, and I'll help you share. I am a PhD in sharing. I am a PhD in being a mental illness patient. If you are the person that put your hand up and said, hey, I'm struggling, then you know what? You have the same power exactly as me. I get on this stage because of my career, but my message, my suffering, is no different than your suffering. If you so choose, you can change the lives of the people around you by just going to, at lunch, saying, hey, you know what? I struggled. I'm on medication. This has been a battle for me, but I'm not ashamed. You're not saying that for any other reason than when someone hears you, they'll go, oh God, thank God there's somebody else. So I'm here for all of those reasons. And I'm here most of all for all of you that put up your hand, because the caregivers are the biggest audience that's out there. And it's the toughest thing to be a caregiver for, because you know, you can't prove the illness, right? So I can't show my wife an x-ray or a biopsy or an MRI. I can't show her anything. So all I can do is tell her about my illness. But my wife loves me, so she has wishful thinking. She doesn't want me to be as sick as I am. So she says things like, we should go for a nice walk. So I have two sayings I want to give you. And this is something that has developed over the years, because I try to speak the language not of the corporate language, not of the great bodies that do great work, the doctors that talk about it. No, this is being a patient. And the saying that I think most represents the lack of understanding between me and my wife, who has not suffered. The walk is a million different things. The walk represents the suggestion from someone who hasn't struggled with a mental illness to someone that has. And it doesn't have to be a walk. It could be, we should go out for a nice dinner. Or, you know what, you should come downstairs and watch TV. You'll feel better. Or we should go on a vacation. Or why don't you do this or that? Those are all in the category of the walk. And I say that wherever I go, and if people get offended by it, too bad. Because you know what? If you suffer, you understand that. And the other one is proud of the shower. Why proud of the shower? The shower, like the walk, represents a whole bunch of things. When you're struggling, and many of you in this room have, and you're lying in bed and you're going, what's the point? Like, what's the point in getting out of bed? My day's going to be terrible. I have no energy. I have no life. I don't make anybody happy. I'm just going to stay in bed. Man, I'm going to stay in bed. And you can't do anything. But then you decide, I'm going to take a step. I'm going to take a shower. And a shower is like kind of the defining thing for many of us, because you hear people say, I was so depressed I couldn't take a shower. So when you struggle with a mental illness, the bar isn't up here like it is for people who are mentally healthy. They would never say, I'm so proud I took a shower. That would be so ridiculous. But when you struggle, you need to celebrate your accomplishments, because you know what? Help is 100 steps away. That shower is the first step. And if you don't celebrate the shower, you won't take the second step. Proud of the shower. Be proud of the little things that you know are massive. But to healthy people, healthy brain people, they would think, big deal. Hear this. My name is Michael Landsberg. I suffer from depression, anxiety, on medication. Gave up a lot to this illness. I'm not ashamed. I'm not embarrassed. And I'm not weak. Thank you.